Um, Good evening, everybody. I welcome you all to today's webinar. It's on study designs in clinical research, which we are jointly hosting as the KMA Research Committee and the East African Medical Journal. We have two guest speakers today who will be introducing shortly. But first, I would like to acknowledge the presence of our KMA National Executive and National Governing Council members joining us this evening, and we'll hand over to the KMA Secretary General, Dr. Simon Kigondu, to make welcoming remarks. Dr. Simon Kigondu, over to you.
Thank you very much. And we want to welcome everyone to these very important sessions. The Kenya Medical Association is committed. The Kenya Medical Association is committed to training and research and publication by doctors. And that's why in the call with us, we have Dr. Amos Otara, who is the Vice President of Kenya Medical Association, and myself, and welcome all of you. We encourage all medical practitioners to do journals with the East African Medical Journal that has been the Kenya Medical Association journal since 1928. And it has international reach, and any papers published with the EMJ will get wide coverage and improve science. In this era of COVID, where science is being encouraged, we encourage all of you to do publishing. And that's why we are bringing these series of webinars to enhance research. And we are happy to partner with other research partners. And therefore, I hope in the course of science for all. Thank you very much.
Okay. I'd like to thank you, Dr. Kigondu, for that very warm welcome and a little bit of information as to what this is all about. So now it's my pleasure to introduce our first guest speaker, Dr. Anthony Ajayi from the African Population and Health Research Center, EPHRC. Dr. Ajayi is a postdoctoral researcher at EPHRC and sits on the editorial boards of 3 journals and has published over 70 articles in peer-reviewed journals. He'll be giving us a talk about quantitative and qualitative research. Anybody who has questions, kindly type them in the Q&A box to type out your questions. I'll request everyone to keep their microphones on mute as the presentations are ongoing. Karibu sana, Dr. Ajayi.
Asante sana. Thank you, Miriam. It's my pleasure to be here this evening. Can you all hear me?
Yes, we can hear you. I can hear you.
Oh, great. So I suppose everyone can hear me. And thank you for the introduction. I'm trying to share my screen. Okay. Can you see my screen?
Yes. I can see it. I hope everybody else can see it as well.
Okay, so today I'll be talking about quantitative and qualitative research designs. So I'll begin with quantitative design. Your research design is very important for your research. The research design you choose will determine whether your research is going to be publishable or not, whether it's going to be acceptable for a degree or not. So it's important that you choose the correct research design, and that's why this webinar is very important to introduce you to research designs. So I said the type of research design you choose for your study has a major impact on, among other things, the sample size, the way you check for validity and reliability, and the resources you would need to collect and analyze your data. So quantitative research design is a research paradigm that's derived from the positivist approach. I mean, that's the philosophy that guides quantitative research, at least as far as social science is concerned. And what do we mean by by positivist approach? It was a philosophy by a sociologist named as Auguste Comte, and it comes from the same from the fact that I believe that we can actually record our daily observations. You know, we can assume that society is ordered in such a way that we can study society scientifically. So we can study things like unemployment, rape, good education, alcoholism. So it believes that we can measure some of these somewhat abstract concepts. So, and that's what we know, commonly known as positivism. So according to positivism, because society is made up of such concrete events it should be possible to make universal statements. To him, he believed we can, study the society and have universal laws that are applicable to all society. So we can know what the cause of crime is. We can say, okay, poverty is the cause of crime. And that was his thought many, many years ago, about close to more than 100 years ago. However, quantitative research has now become broadly used in medical research, in social research in general. And the concern of quantitative research is to measure relationship and to find association between two variables, So I will be speaking about, all the different types of quantitative research before we then talk about qualitative research. So the two broad types of quantitative research are descriptive and experimental designs, or we can call it observational studies, as you probably prefer to use that in clinical research, and experimental designs. So the main aim of quantitative design is to determine the relationship between one thing called a variable and another. So usually there's always an outcome and then there are predictors, or there is an outcome and then there are independent variables. Let me give an example. You can see, say for instance, does education correlate with leadership ability? Or what is the relationship between educational attainment and domestic violence? Or does marital stability depend on religious belief? Again, here, they're basically looking at association between two variables or relationship between two variables. Not necessarily a causation relationship, but more like an association kinds of relationship, or more like factor associated with something. The factor may not necessarily be the cause. For instance, poverty may not necessarily be the cause of crime, but poverty is associated with crime. So again, there are a lot of statistical tools to test this association. And again, if time permits, we may get to all that. Whereas in experimental studies, we are trying to be able to then find out the possible or potential causes of a particular outcome. Again, we may want to know what is the cause or what is the effect of a particular treatment on survivor or on getting better, So again, you may want to know what is the effect of hydroxychloroquine on survivor from COVID, okay? Again, if you are doing that type of research, you probably need to do an experimental research, or you may need to do a randomized control trial, and then be able to control for all other variables and be able to detect whether the effects, or whether hydroxychloroquine has an effect on COVID survivor. So again, there are broad examples of that, but I will not go into that because I know for sure the second speaker will be speaking on experimental design. But again, just to focus on descriptive design, there are several examples of descriptive design, including, your cohort studies, your cross-sectional studies, and I probably may have time to talk about cross-sectional studies as we go along. So we say in a descriptive study or survey, you describe things as you find them. You don't provide any intervention. So examples of descriptive designs are surveys, case studies, case series, cross-sectional studies, case control studies, as well as cohort study. And for your case series, a patient's walk into the hospital with a certain condition that is strange or rare, and you want to document the case, you want to document how the patient presented when the patient came, the series of treatment you administered, and then the outcome, whether the case or the patient survived or died. You can publish your case studies in journals, in medical journals. They're actually well accepted all over the world. So you see one patient is a unique case. It's a case that there's probably only one in the past 20 years or one in 40 years. And then you see the case, you want to report it. And those are examples of case series that you can publish in journals. And then there are also what we call surveys. Those ones are the common ones. So you say, okay, you want to find out who is likely to win the next presidential election in Kenya. So in that case, you conduct a survey, and the popular poll, the opinion polls are quite popular, and those are good. There's great examples of surveys. Those ones are probably the largest surveys you would see. The surveys in 2016 for US election did not do so well because they predicted that Hillary Clinton would win, but she did not win. But again, in 2021, you see that the surveys were quite accurate in predicting the winner of the election. So surveys are actually very good. They are not necessarily the gold standard in the gold standard scientific evidence, but they can yield very meaningful results. So surveys are also usually cross-sectional studies as well. So cross-sectional study is basically talking about the time period that a research occurs. So when we talk about cross-sectional study, we are saying it's a study that occurs at a particular point in time. Whereas when we are talking about longitudinal study, we are talking about a study that you conducted over a long period of time. So when you study, say, domestic violence, at one point in time, it's a cross-sectional study. But if you want to document cases of domestic violence over a 3-year, 4-year period of time, then it becomes a longitudinal study because you're studying the outcome over different times. So these are examples of a quantitative study. And we have to move quickly so that we have time to get to qualitative study. But again, just note, if you are going to take anything away from this webinar, note that quantitative studies, deals with numbers, it deals with counting, it deals with learning about, relationship between an outcome and predictors, or an independent variable, dependent variable and independent variable, and no examples of quantitative studies, which are broadly described as descriptive and experimental designs, as well as when we talk about descriptive designs, you are looking at surveys, case series, case studies, cross-sectional studies, and case control study, as well as cohort study. Now, a big distinction between descriptive and experimental designs is that experimental designs, entails that you add a stimuli. The stimuli could be a medication that you are using to elicit an outcome, treatment. We are putting a treatment to make a patient get better. So when you are studying that, the only way to know whether the treatment works or not is to also compare with a group that you give probably a placebo. And then you are talking about the experimental design. So again, I will just skip this slide for the sake of time. And then I'll move here. Okay, I'm going to share my slides so that you can go through it, but I want to move quickly because I only have 15 minutes. So let me just move straight away to issues of validity in quantitative study. So for quantitative study, quantitative study deals with measurements. So when we are talking about age, you are going to measure age. When you talk about gender, you are going to measure gender in a quantitative study. When you talk about unemployment, you are going to measure unemployment in a quantitative study. Or for instance, when you talk about hypertension, you are going to measure hypertension. So everything you do in quantitative study deals with measurements. So the key question then is, how valid is your measure? Okay, are you using tape rule to measure weight, or are you using the weighing scale to measure height? So it's important that the method you are using to measure a particular variable is valid and reliable. Okay, so when you are doing quantitative study, you need to take into consideration the validity of your measurements. So for a valid estimate of a relationship between variables, quantitative studies such as a social survey typically requires randomly selected samples from a large population. Without this, the validity of the data obtained and the conclusion reached could be in question. Now, this is also very important. When you are conducting now your cross-sectional study, you need to think about sampling as well as the appropriate sample to select, as well as the method of selection of your participants. So how did you arrive at the number of people to select? So there are lots of formulas we use to estimate the appropriate sample size for a study. And again, we may not be able to go into these, but again, just note that when you want to find out, say, the prevalence of domestic violence in Kenya, then you need to think about how many people would you need to interview to arrive at the prevalence of domestic violence. And the next question will be, how would you select this number of people? So it's important that you answer those two questions, and there is no rule of thumb to it. When it comes to quantitative study, there are formulas to estimate the appropriate sample size. Whereas when it also comes to sample selections, we may not be able to touch on all the different sampling approach, but there are also appropriate sample methods to use. So issues of validity, of course, is also very important. You always need to find someone to peer review your questionnaire, to check for face and content validity, as well as if you are using a construct, you need to determine, to check the Cronbank alpha to see whether there is internal consistency in your measure as well, or in your construct. And usually when you present the findings of a quantitative study, you use figures, tables, statistics, graphs, and charts. And then you narrate them by, for example, you might say the prevalence of HIV in Kenya is around 5%, and then men are more susceptible to HIV compared to women. Those are some of the ways to explain the findings of a quantitative study. Now I will skip, while we move quickly to talk about qualitative design. I think I have maybe less than 3 more minutes. So for qualitative studies, qualitative study, emanated from this interpretivist paradigm. Okay, and what do I mean by interpretivist paradigm? It's another school of thought that believe that we cannot quantify events in society. Okay, that's the school of thought that we call interpretivist. So the school of thought only means that we can only interpret and give meanings to events. That human beings are too complex. As such, you can't objectively study them, but you can only subjectively study their experience. Okay, so that's the philosophy that guides qualitative study. It's a philosophy that believes that you cannot count and number all events. That rather, we should seek for meaning. We should seek for interpretation of events. I'll give you an example. And the example relates to, if you hear someone scream far away from you, there are different meanings to that screaming. The person may scream because the person is in danger. The person may scream because the person is actually happy and is celebrating. Maybe he just won a lotto, just won a lottery. He just won a gamble. The person may scream because he was just calling or shouting to call someone. Because that scream alone has different kinds of meanings. You cannot just simply be counting. You have to look for and seek for meaning. As such, that's the only method to understand society, and that's the philosophy that governs qualitative research design. So the most popular example of qualitative research designs are individual in-depth interviews, ethnography, focus group discussion, observation, life history, and narrative study. And these are important tools that we use in qualitative study to, generate meanings about events that is happening around us. There's been a lot of quantitative study now investigating COVID. But again, are people making meanings out of their life, out of this experience of COVID? You need a qualitative study to go deeper, to study in depth and interview people and understand the meaning people attach to COVID. Why do some people believe that there is no COVID? Why do we have COVID deniers? What is the rationale behind denying the obvious? So you need the qualitative study to dig deeper, to really understand meanings that people attach to some of these events, how people make sense of some of these events. So notice that in each of the methods, the main research instrument in a qualitative study is the researcher himself. In quantitative research, the main instrument is your questionnaire, is your measurement, your instrument. But in qualitative study, you are the main instrument. And it's a very labor-intensive, sometimes manual process in doing a qualitative study. So notice also that in each of these methods, the researcher is seeking non-numerical, verbal or non-verbal data rather than measurements. So the departure point for qualitative researcher is the insider perspective on social action, or what we call the emic perspective. Insider perspective is the lived experience of the research subject and the meanings he or she attaches to the phenomenon being studied. So the overarching question in a qualitative design is why? Why does a particular event happen? Why does a particular phenomenon occur? So for example, why a quantitative researcher may find out the prevalence of rape in a population, the interest of a qualitative researcher could be to interview a small number of rapists to understand why they commit rape or why they commit crime. So for a qualitative researcher, they are out there to look for meanings. And it's actually very important because oftentimes when you conduct your quantitative study, you may see that men and women differ in the outcome you are studying. So the key question then remains, why? Why do men and women differ? A quantitative study may not actually provide the explanation. It may just show you that there is a difference or there's a relationship between gender and crime. Men tend to commit more crime than women. The question is why? So if you interview people, if you interview male criminals, you will then find out why they tend to commit crime. If you interview female criminals, you may begin to see some of the differences or some of the explanations that you may not be able to find in a quantitative study. So qualitative study rather complements quantitative study. And again, there is a third design called the mixed method approach. You may not be able to get into that, but that's where you begin to see the intersection between quantitative and qualitative study. So I just go further again. It says this is because qualitative researchers do not believe that social universe is so ordered that one can always link one objective event with another. So usually when you interpret qualitative study, there are tools to interpret qualitative study. There is the NVivo, the Atlas TI, and some other tools, and some other tools that you can use to generate quotes and generate what we call, you do what we call thematic analysis, or you do content analysis for qualitative study to really then begin to organize your results into teams and then discuss and use verbatim quotes to support some of the explanations or the meanings you are generating in your data. So in quantitative study, we don't deal with number. We are basically interested in meanings and all that. Now, in terms of, there are researchers now that have been.
Dr. Jai, sorry to interrupt you. Just wanted to inform you we're running out of time. If you don't mind summing up.
So I think this is my last slide.
All right.
This is just my last slide.
Okay.
So when it comes to, so there's very much, this is very much in line with how social researchers encounter social reality in the field. So qualitative researchers believe that their task is to unearth the various dimensions of people's lived world, lived experiences, rather than strive to measure and quantify what is often neither measurable nor quantifiable. So finally, on a final note, qualitative research is important if a researcher is trying to understand the natural settings of social action, make sense of enduring social processes, bring out the insider perspectives, or uncover social contexts that underpin a given social action. Often, researchers compensate for the weakness of either quantitative and qualitative research by triangulating the two approaches. Again, the concept of triangulation is also an important concept that we may not be able to touch today. However, it's also an important concept to read about, so as to enhance the validity of research findings. I mean, there's a lot to talk about. The time is short, and this is my best summary of what qualitative and quantitative research is. So I'll be looking forward to taking your questions. Thank you very much.
All right. Thank you so much, Dr. Ajay. That was a rather extensive piece of information that you have given us. I'm sure I've seen a bit of questions that we're having in the Q&A section, so we can address that towards the end. And now up next, it's my pleasure to introduce Professor Gunturu Revathi, who is known to most of us. Professor Revathi is head of clinical microbiology, Department of Pathology at the Aga Khan University Hospital, Nairobi. She's an associate professor in microbiology and also a consultant microbiologist at the same university. She has been at the current position from the year 2006 until to date. She's a faculty and external examiner as well at the Jomo Kenyatta University of Agriculture and Technology. From the year 2001 to date, she's also chief medical specialist, a consultant microbiologist, and head of department of laboratory medicine, Department of Medical Microbiology at the Kenyatta National Hospital and College of Health Sciences at the University of Nairobi. This was the year 2000 to the year 2006. She is visiting collaborating scientist at KEMRI from the year 1999, up to date, and a senior medical specialist and consultant microbiologist at the Department of Laboratory Medicine and Department of Medical Microbiology at KNH and College of Health Sciences, University of Nairobi in the years 1997 until 2000. I would also like to mention she's professionally associated with the following bodies: International Society of Chemotherapy, a member of International Society of Chemotherapy, Infection Control Africa Network, Kenya Association of Clinical Pathologists, Association of Pathologists of East Central and South Africa, European Society of Clinical Microbiology and Infectious Diseases, International Society of Infectious Diseases. Karibu, Professor Revathi.
Thank you very much, Dr. June. That was a very kind introduction. Let me share my screen. Doc, is my screen visible?
Yes, it's visible. We have a good view of it.
Thank you. So, thank you very much, organizers of this webinar, for inviting me to share a few thoughts about study designs with this August gathering. I have seen very knowledgeable gathering, asking actively questions, and a good number of participants are here. So I'm very grateful for the organizers and the participants for this evening, giving me this opportunity. After listening to Dr. Anthony's uh, very knowledgeable presentation, quite a lot of, this is a presentation done by a professional researcher who's thorough in his research methodology, and the stuff he presented is really of very high level. And I'm quite impressed and overwhelmed by the depth of the presentation. So immediately I decided that not to sound repetitive, I will just go back to the basics and recapitulate what is the basic philosophy of study designs. And I will not go into all the details of the study designs. I will just speak about the outlines so that this August knowledgeable gathering just recapitulates some of the study designs. And what I'm going to present is really very basic stuff. So we have looked at COVID, which is now our life is full of COVID currently. So there is no escaping from that fact. It's quite a big thing now for this millennium, I think. But luckily, we are starting the vaccination. So vaccine is available. So that is the good news. So hope is alive. I don't have any conflicts of interest. I'm not being paid by any company to make this presentation. This is my hospital, Aga Khan University Hospital. Most of you have seen. This is the laboratories on the ground floor, the ward block, and I'll quickly share a few of. I don't know why this slide is not moving. That is Heart and Cancer Center, core laboratory, my TB laboratory. This is the chemistry laboratory. This is my section. I'm a medical microbiologist. This is the food for bacteria. The culture media are prepared and stored in the microbiology section. These are my microbiology. These are the biosafety cabinets. This is my microbiologist in front of an automated bacteriology analyzer. This is molecular biology section. Why am I showing you all these things? Because most of the diagnostic procedures are results of research. Years and years of research, some of them products of hundreds of years of diligent research by people who devoted their entire life. So I am into diagnostics. I'm head of the diagnostic microbiology division. And this is what is research is all about. Somebody does all the research and somebody uses the research products, like we are using all these tests and the test kits and all these things, which are results of research. So research is very, very important. So quickly, I'm just going to touch on the basics only in 15 minutes. What is anatomy of research? Research is you define a problem. What is the characteristics of this problem? Then you specify the objectives. This is what I want to do. Or sometimes there is what is called a hypothesis. There is a theory. Like in diagnostics, I want to make a diagnostic test for such and such a viral infection. Could be my objective. And then the hypothesis is that I want to base this diagnostics on this part of the pathogen. I want to detect the capsular carbohydrate, or I want to detect the spike protein in case of COVID virus. We say that we want to detect the spike protein, and then that can be a diagnosis. Then select a design or type of the study. So that is the next step. When you want to, you have an objective, you have a philosophy, a hypothesis of your research, then you want to select a design. And a design is actually what you are going to do, a protocol or a procedure or a particular work plan. That is the design of your research. Then you will go and you select population, you collect data, you analyze, you determine conclusions and all this. And Dr. Anthony has also told us a lot about the designs, very in-depth about the designs he has already told us. So this is the process of research, which is more or less the anatomy. problem selection, literature review, it goes like that. Formulation of research objectives, variables also. Anthony has told us about the variables, the complications there, and selection of appropriate study design is the next step. So you select the design, then sampling the population, all that until presentation of your findings. So what is the objective of my, my presentation is just to understand different types of study design, recapitulate the basics. So what exactly is study design? A study design is a specific plan or protocol for conducting the study, which allows the investigator to translate the conceptual hypothesis into an operational one. So you have a concept, you have an objective, you want to do this, you want to design a kit, or you want to produce a diagnostic or something, but now you are operationalizing that particular plan, and that is a design. So there is no best type of study design. How do you choose a study design? What is appropriate design? There's a lot of discussion around this. So if you see this slide, it shows all this confusion. It's a lot of confusion because, why is this a confusion? It shouldn't be, because this research has now become very much systematized and standardized. Now, I must just take the example like in a village, in a typical village, say in Kenya, if we drive 40, 50 kilometers outside Nairobi, go into a rural area, if there is any water body, the villager knows from childhood how to swim by nature. Like the villager also knows how to sing. He sings very nicely, he sings and he swims. Did he ever go to swimming class or singing class? Did he take formal training in singing? Certainly no, but he can sing. This is opposed to a very accomplished singer in Nairobi who has been attending regularly in the French embassy some singing classes or some piano classes, or is going regularly to such and such a place to take swimming lessons. So what is the difference between the villager and this one? These people are trained systematically by experts in that field. The piano teacher or the music teacher or the master who is teaching you how to swim, they are experts in their field, they are trained, they are experienced, and they are teaching you how to do it. And they do it in a systematic way. So that is the difference between research which is done by all medical colleges. We do some research. Because if I have an MEd course in any subject, there is a thesis which is required to sit the exam. That is part one of the exam is a thesis. For every MSc, you have to sit the exam, there is a thesis. For every BSc also they introduced a project. And even now school children are forced to do some summer projects or winter projects, 10-day project or a short project or something. So everybody is doing some project, and this project is called a research project. So now that is something very basic. Without training, these projects are done. The teacher is guiding you. The teacher may not be a very trained researcher. So similarly, I can say for myself, I'm not a professional researcher. The research which I do is mandatory because I have to guide or supervise an MEd resident. The resident needs to do a thesis project, and this project is research. Basic philosophy here is to initiate the resident into research methodology. That's all. That is, they learn the theory around research, how to do research, how to conduct research, ethical conduct of research, scientific etiquette during research, and similar things. And they choose a topic within their curriculum. They do a thesis, which is very short, maybe 6 months. They don't even have 1 year to do this project. So all of us are aware students are doing lots of projects under these circumstances. But that is not the research. When you talk about methodology and the design of a study, and then this August gathering who are listening to this webinar, it's about standardized research. The standardized research is classified, there is a lot of science around it. And if I can tell you, there is just a master's course just about clinical trials. Clinical trial is one of the research methods, and there are various designs within a clinical trial: a randomized trial, a double-blinded trial, a quadruple-blinded trial. There are so many designs in clinical trials. I will share a few with you. Just one of them I might share with you, because there are hundreds of designs within clinical trials. So just one design, a clinical trial itself, is a huge science. There is an MSc course. There is also a PhD which is devoted to this clinical trial methodology. Within that, there are so many subspecialties, branches which have developed just about designing a form for adverse event reporting is part of a clinical trial. Then ethics around adverse event reporting, how to quality control a clinical trial, how to standardize a clinical trial, how to develop a trial, how to document a trial, how to collect the data, how to analyze data. There is huge science around it. So that being the case, what we are going to look at, there is no best type of study design. So what determines the choice of the study design? The context, assumptions, paradigms, and perspectives decide the type of research methodology. That is a proper thing to do. What is the context? The design will be determined on the context. And what are the assumptions, paradigms, and perspectives? And beyond these four things, there are many more considerations when you are choosing a particular research methodology, which is a study design. So just quickly recapitulate, we have all these types of research: applied research, action research. That is, we want to go and discover something, original finding. Like now the NASA experiments going into the space and all those things, they are, I think, actually results of action research. Then evaluation research, basic research. Basic research is the gravity, the cell structure, all those biology, lot of biology, basic biology. So there is basic research. So the context which I mentioned will fall into one of these. Then how do you choose a research design? Beyond, there are so many considerations. We said, does it adequately test the hypothesis or the philosophy which you have chosen? Is it addressing that adequately? Does it identify and control extraneous factors? The design which you are choosing, is it able to control some external influences and things like that? And will it be able to identify those things? Then, are the results which you are generating from your research, will they be generalizable? Can the hypothesis be rejected or retained via statistical means? Is the design efficient in using available resources? Now, the last bullet is not the least important. Perhaps it is the most important, because all research is expected to be cost effective. Then, these days, research is very expensive. The first step, you seek permission. If you go to Nakosti, first you have to pay 20,000 shillings as fees. So money is required. Do we have enough money? And the design which you choose, is it fitting the budget? That is, you have to make your design which can be affordable. So all those are the important considerations as you choose a design. Then selecting a research design, again, it will also depend level of knowledge. The researcher is a very experienced, proficient researcher, will choose a very challenging design, right? But a novice a researcher who may not be such an expert will choose something easy to do. Because when we are discussing what is called feasibility of a research, that's called feasibility. Then when we do the feasibility, we think, now this is going to be very difficult. Like a researcher says, now doing blood cultures is very expensive, very difficult. Let us go and do urine cultures. Collecting urine is very easy, and the culture is also cheap. The culture media are cheap. So they are less expensive. Let us choose now urinary tract infection as the topic rather than bacteremia or sepsis. Hello.
Can everybody please mute their mics?
Am I audible? There was a big noise.
Yes, you are. I think somebody's microphone
I
accidentally
continue?
went on. Yes, please continue. Yes.
Sorry about that. So I was saying the feasibility, when we discuss the feasibility, we think of the costs, we think of what is easy to do. So instead of doing bacteremia sepsis research, somebody chooses to do urinary tract infection. So those are the other considerations in choosing the designs. Nature of the research phenomenon, nature of the research purpose, ethical considerations. Can I do this? Can I go and do this intervention? Is it ethical if I put it in my design to be doing a particular procedure which is painful? Is it ethical to do this? Then feasibility, which we have already talked about, validity and availability of data, precision and cost. These are the very, very important considerations we have to, okay. How to choose a research design? I think we have already seen this. Okay, types of research. So I think already Anthony has spoken about this, so I won't go into details of this. Just broadly, application research, objectives, type of information sought. Then you have under application, pure research, applied research, under exploratory, descriptive, correlation research, and explanatory research. This is different from exploratory research, explanatory research, right? Then type of information sought, either you are quantitative or qualitative. This we don't have to dwell at all because Anthony has given us a lot of this stuff. Okay, these are quickly the types of studies: observational and experimental. In observational, the correlational study, case reports and case series, cross-sectional, all this stuff you people know already, case control, cohort. Experimental, community trials and clinical trials are very, very important. I have already told you so much about clinical trials, I think. Okay, these are the designs broadly: descriptive, cross-sectional, cohort, case control. Then comes randomized trials and survey research. Survey research is very popular, and surveillance is part of this survey research. Surveillance is trying to watch any particular occurrence, being vigilant, and we have a lot of AMR surveillance which is going on in the country to detect multi-resistant organisms. Similarly, surveillance for COVID variants is a popular topic now. Okay, when we divide and classify the designs, it should fit into a critical thinking decision pathway. That is, we have chosen a problem, there is a research question, and there is a philosophy, a fundamental philosophy for this research. There are certain objectives, and somebody is choosing design. Then there are critical thinking decision pathway. So just, I won't go into all the details of this table. Just a problem, very little is known about the variables. Yeah, variables, I think Anthony has already touched upon. So very little is known about the variables. So you go into surveys or descriptive designs, exploratory designs, or comparative designs. So your design will depend upon what it is to start with. Then if you have to test relationship between variables, you are going to now correlational type of designs. So there will be a retrospective, past, post view, retrospective designs, or present view, correlational, cross-sectional design, or present future view, longitudinal, prospective designs. So depending on what you are starting with, your design will vary. If you have to compare differences between variables, you choose a different design. If you need a measurement tool, there is a methodological pathway you go. You have to apply that critical thinking. You choose depending on what you are proposing to do, your objective, you will now change the design and choose a design. So this is basically summary of all the designs. So all designs will fit into this. This is a broad classification of all the designs. Basically is the investigator assigning exposure. If you say exposure means there is an intervention, there is an occurrence which is happening. Yes and no, it goes in an algorithmic way. And now this particular thing captures all the designs. This is from a journal. All this is from a journal. What I'm talking about is published stuff. It's not my own composition. All this is published, and this is from the journal. There is a reference. So qualitative, quantitative, this will be repetitive. I should simply skip this. Case reports, case series, population studies. The use of these for medical fraternity, case reports and case series are very exciting. They give us new knowledge. Population studies also give us new knowledge. But I will tell you something more about it. All of you know, they don't count as serious research. If I publish a case report, it's not counted as serious research. I don't get many points when my research points are being counted by the university. The points are counted if it is a randomized clinical trial. If it is a case report or case series, I don't get any marks. Though a lot of these are very, very important. We are managing patients based on these sometimes. When we find a case report, we take it actually in case of COVID. We regularly follow what is happening. Most of them are case series or case reports. So this is okay. The use is hypothesis generating and suggesting associations. Very, very important in medical science. Descriptive epidemiology, including activities related to characterizing the distribution of diseases within the population. I don't have to describe this. So place, person, time. Think of this as a standard dimensions used to track the occurrence of disease. That is descriptive epidemiology. Very, very important part of research design. And descriptive designs are describing facts, discovering new facts, or not invent new theory and methods. Largest effort given on data collection. It answers questions, satisfies curiosity, and solves problems. So descriptive research design is very important. Case control studies now. This is CS study, means case control study, which is usually snapshot, very short, something like cholesterol measurements, ECG measured at the same time. So it determines prevalence at a point in time. Therefore, cross-sectional study is something like a prevalence study. The advantages, it is a snapshot, short term, very few resources required. So most of our postgraduate thesis is a cross-sectional study. There is less statistics involved, more easily controlled, design is less complex, and also they are comparatively cheaper and short term. So most of the postgraduate studies, they take this particular design. Disadvantages represents only those who are surveyed. Yeah, identifies prevalence, not incidence necessarily, excludes cases that died before the study was done, shows associations with survival, not risk of development. So there are lots of limitations. These are just 4 points. There are 12 to 14 limitations of cross-sectional studies. Cohort study is another design. Quickly, cohort is a group which shares similar characteristics, we know, and cohort studies have their own advantage. And these days, expensive professional research takes the form of a cohort study because these cohorts are prospectively recruited. There is a particular area you map, you gather all the data about the households, and you know everything. Now that cohort, you know the population, and now you are going and doing all your researches there. When is a cohort study suitable? When good evidence suggests an association of a disease within a certain exposure or exposures, cohort study design is very, very suitable. Case control studies are very important because you have a case and you have a control. That is a very good design, excellent design. This is frequently used, carries good weightage. Participants selected on the basis of whether or not they are exposed or deceased. Those who are deceased are called cases, and you match some controls, age and sex, and you have healthy population there who are not exposed or deceased or didn't get that condition. They are the controls. This everybody knows. So I'm sharing with you one particular, I said case control studies and clinical trials have lots of designs. This is an interesting design called split mouth design. This is popular among dentists. So one side of mouth stays as a control, the other side is the test. So the previous slide which I have shown you, you see this in the mouth. On the right side, they are using chlorhexidine. They are applying to this tooth. On the left side, they are using calcium hydroxide with some camphorized some compound. With camphor and calcium hydroxide, they apply to this tooth. So this is a trial to compare the efficacy of these two compounds. One is chlorhexidine, the other one is calcium hydroxide, to control the anaerobic bacteria and then to control a particular dental problem. So instead of, this particular design is in the same patient, right side of the mouth, left side of the mouth, the teeth are different. Both teeth are affected. You are using different agents. This side you are using chlorhexidine, other side calcium hydroxide. And then the patient is asked which tooth is better, right? So he will tell you whether the right side is better or left side is better. So you know whether calcium hydroxide is more efficacious or chlorhexidine is more efficacious for the particular end point. That is to reduce the sensitivity or to reduce the pain or to reduce the swelling of the gum or whatever was the end point. In this particular case, it was reduction of anaerobic bacteria in the mouth. So this is a very unique design called split mouth design, and this is also a part of clinical trials, and it is very popular among dentists. But there are certain disadvantages. Every design has an advantage and a disadvantage. And what is the disadvantage here? So you apply something to the right tooth and something to the left tooth, and then they may not just stay on the tooth. There is what is called carry-over effect. So what they do to obviate this particular problem, they use one agent on the right side only for 7 days, ask the patient to tell the effect, they record it, and then the next 7 days after this agent is removed, now you use the left side of the mouth, the left tooth, and apply the second agent and again record the effect for the same duration after asking the patient how he is feeling. So there are certain endpoints how you decide. So the patient will tell you the left tooth is better or the right tooth is better, and then you calculate the efficacy. There is a lot of complex statistics also goes into this kind of methodology. So relative strength of various study designs. So when you choose all these designs, strength, strong and weak. So weak from down to up, the arrow is going. The designs are starting from case report, case series, cross-sectional, case control, cohort study, clinical trial is on the top, right? So the evidence is considered the strongest if it is a clinical trial. It's supposed to be the weakest if it is a case report. And I think I close there. Thank you very much for your attention. Thank you.
All right. Thank you very much, Professor Rebathi, for that well summarized but detailed information presentation rather. So for now, we are going to have a 15 minutes question and answer session. And I'll now hand over the meeting to the moderator for that session, Professor Elias Onditi, who is a professor of radiology and imaging at the Moi University and also the vice chair of the KMA Research Committee. Welcome, Professor Onditi.
Thank you, Dr. Leach, for that introduction. Ladies and gentlemen, this is now the QA session. We have at least 10 questions from members, but I'll start it off. There are actually 11, but I'll start them off by mine, by requesting for the presenters who did a very excellent job to give us suggested reading and reference materials, so that later on after this, we can find more about this illuminating discussion. The first question is from Kipkoech Maureen. The speaker can explain well to me, is level of education a quantitative variable? That is the first question. Any of the two speakers, guest speakers, can answer. Over to you, Dr. Ajay and Prof. Prof. Revati.
Yeah, usually level of education, it's a variable that is quantifiable, although you know, when we talk about different levels of measurement, there are 4 broad different levels of measurements. So it belongs to a level of measurement that we call categorical variable, because you can categorize them into, say, primary, secondary, higher education, no formal education. In that sense itself, it's not necessarily a numeric measure itself, or a continuous variable like age. But again, we can still use them in statistics to see whether there is a relationship between the level of education and a particular outcome. Usually in some contexts, or to be more specific, we find out that people that are not that do not have formal education often have worse outcomes compared to people with say higher education. Now the reasons are obvious. So I mean, in statistics, we tend to categorize education as and try to quantify it. Thank you.
The next question is also to any of you. Maybe Prof. Revati could answer this. How does one ensure validity and reliability of qualitative tools and instruments, and how to select sample size for FGTS and KI interview guidelines?
Thank you so much. You see, validity, this is a very big procedure, and sample size calculations are also a very big procedure. There are formulas to calculate the sample size. You start with what is your problem, and all the studies don't need a sample size calculation. This is a big misunderstanding around research, that every study requires a sample size calculation. That is not true. Because of this misconception, there is a proposal which goes, and then the panel is asking, show us your sample calculation. So there are lots of studies where sample size calculation may not be relevant. So that is number one. Number two, the sample size calculation will depend on the objectives, the problem, and the context. So basically, if you are studying a particular condition, you need to know some previous information on the prevalence. One example, like the prevalence of the disease is 10% in the population, or it is more than 60% in the population, or it is very rare, it is only 1%. So that kind of information you need, and you put that information into a formula, and the formula will be selected on various other conditions, and then you calculate your sample size. Then the science is sometimes very vague when it comes to certain studies. So a sample size which is calculated by a very experienced statistician, when the researcher is presenting this to the committee, there is another statistician sitting there who completely quashes that sample size calculation. So I myself, I have been very, very confused sometimes about this. One example is supposing, for example, MRSA in Kenya. There are publications that MRSA is 40% prevalent in hospitalized patients. There were some methodological issues. Then there is another publication says that MRSA is never found in the country. So how will you calculate your sample? You will not be able to apply both. Then there is one philosophy that if you don't know the prevalence, you just take it as 50% and you calculate your sample. So this is highly contextual, and I think it takes a long time to explain those things. So maybe we should answer this offline to the candidate. We can give some reading material because it's a long answer. I don't want to go into another lecture mode. Thank you.
The third question is, what do we mean by double-blind study? Is it part of quantitative research? Dr. Ajay.
Yeah, so for double-blind study, I mean, when you speak of double-blind study, you're talking about a randomized control trial. You know, in that case, both the patients and the researcher are both not aware, or they are unable to distinguish who receives the treatment and who receives the placebo. So in that case, we say it's double-blind. That's and it's usually in quantitative study.
Yes, the next question, number 4. Please, I need more explanation on sampling. That's why I was requesting for suggested reading material and references, because we cannot exhaust these in 1 hour alone. So we will wait for the reference materials later. The next question is, hello, in the previous slides, questionnaires was under quantitative design. My question is, if the questionnaire contains questions, if, why, how, will it be considered a quantitative? Prof. Revathi.
I think this is Anthony's question. Come again.
I can take it.
Yeah. Okay, let Dr. Ajay take it.
So usually when you design a questionnaire, you want to try as much as possible to ensure that all the questions there are measuring a particular variable. So you wouldn't want to design questionnaire and ask a lot of why questions, because it then means that you are going to be getting narratives rather than, just having someone, choose an option. So again, it presents a challenge of interpretation. So if you're interested in why, in fact, if you design a questionnaire that is filled with so many why, then perhaps you should consider a qualitative study. Or you can do a mixed method study so that the why could then allow you to dig deeper and do a thorough, in-depth interview that will then help you to generate the explanations for some of the results you found. Usually the best practice is to keep your questionnaire with structured questions. And what we mean by structured questions are questions with exhaustive responses or responses options that participants can easily choose from. But if you're interested in probing why, then you should consider adding a qualitative study to it. So generally, in questionnaires are usually categorized as quantitative studies.
Thank you, Dr. Ajay.
Chairman, sir, Can I take one question which Professor Aluch has put on the QA box?
Go ahead, Prof.
Professor Aluch is asking, what is the role of artificial intelligence in current research design and current modifications in design due to the COVID pandemic? So thank you, Prof, so much for this question. We have artificial intelligence and machine learning, which is now being used a lot in research, and they have a very great role to play. And that is, if you choose any problem, you now design a computer program and you feed data into that, basic data, whatever you have, you want to collect, you feed into that. And then this machine model can now take the data online from off-site, somewhere distant. Like I have the computer program here in Nairobi, but the data can be posted from, say, Los Angeles or from some place in Australia, somewhere, anywhere on the globe. If you have the connection, you have connected, the data is all gathered there. And then you teach now this machine by feeding different parameters, and then how to even, collate the data. And sometimes the artificial intelligence model learns every time you are feeding different parameters into that. So the machine actually sometimes is able to respond. It is not actually like human brain, but it is as good as a human brain, next to human brain. And these models are improving, and you can go on modifying and improving the model, the machine learning. And this is a very good research tool. And of course, the building the model is a lot of expense, takes a lot of expertise, and takes some time building it and standardizing it until it is able to perform for you is a long drawn process. But once the model is built and the machine has learned and you have set all the data, then it's an excellent tool, and it's a very good research tool now. It has a great role to play, especially the neurocognitive functions research, a lot of brain functions, cellular functions, basic research is all taking now the artificial intelligence machine learning model. Thank you for that question. Thank you.
The next question is from an anonymous attendee. How do you approach comparison of research findings, say outcome of treatment of a disease like COVID-19 or endoscopy findings between patients in two hospitals where sample sizes of study participants are different in the two study sites? So that is a clinical trial, comparisons in two clinical centers. Anyone of you, Prof, or Prof,
I think that will be, that will be a limitation of the study. If you have two centers, it's a multi-center study, and you have two centers which are totally different. But usually multi-center studies, when they choose centers, the centers will be distant. They may be even different countries all over the globe. There is a process of 3 to 6 months of standardizing the procedures. Supposing there is an endoscopy, the study is about endoscopy. So you standardize all the endoscopy rooms within these study sites, and you take all the endoscopists through a common training which is related to your research methodology. And whatever they are doing some biopsy or sampling. And when they are doing some endoscopy, it is a visual thing, then they post photographs, they take pictures and videos and post them. And then there is again a review by another independent party to smoothen out any issues. So that is how the multi-center studies are done. So if that is not done, one center is say a public hospital with very low resource, then there is a big private hospital with a lot of resources. The patients are also different. Then that will be a study limitation. It will lead to a lot of problems. So usually multi-center studies have a process of standardization to equalize all the centers. Thank you.
The next question is from Kipkoech Maureen. Is it a must for a cross-sectional study to start with a prevalence question in your study in master thesis? For example, if one is doing determinants of uptake of breast cancer screening among women, is it a must to start with prevalence question on breast cancer screening? Dr. Ajay?
I would say because you are going to collect information to be able to answer the questions on determinants, you are going to estimate prevalence. So having that question may be a good objective. I wouldn't say it's a must, but I think you are going to be doing it anyway, so you might as well include it as one of your research questions. And prevalence is very easy to estimate. It's probably one of the easiest. It will be one of the easiest research questions to answer anyway. So in that case, yeah, I would, if your supervisor, insists that you put the question on prevalence, and then I would say, yeah, the supervisor is right, and having that question as the number one question is good. I wouldn't say it's 100% compulsory, but since you are going to be estimating prevalence to be able to answer the question on determinant, you should include the question on prevalence.
If I get it right, the Maureen's question is, we see the study question is determinants of uptake of breast cancer screening among women. So what is the prevalence of breast cancer in that population is not directly relevant. If you don't go to that, straight away design your study with a questionnaire or whatever method you have chosen, and you collect this information. What determines the uptake of breast cancer screening? It should be quite okay. That's what I feel. I may be wrong. I don't know.
Yeah, so to add to that, screening, determining the prevalence of breast cancer may be outside the scope, but determining the prevalence or the uptake of breast cancer itself is within the scope. So you want to know what is the proportion of the population that, or the proportion of the sample that you are studying that have ever screened for breast cancer. So it's just, if you study, say, 400 people and 200 people are screened for breast cancer, so you can say the prevalence of screening uptake is around 50%. And then you can then go from there to answer the question on determinants. So again, if you want to determine the prevalence of breast cancer, maybe that's outside the scope, just like Prof has alluded to.
That brings us to the next final three questions. What is an open label study? To any of the guests? Yes. Open label, yeah. Go ahead, Prof.
Open label is open label. You see, there is these studies, when you conduct them, there is a particular design called intent to treat, open label. That is, there is no information which is not disclosed in this case. So you know what is the intervention which is to the participant, to the researcher. There is nothing which is hidden. So these are all open label studies, as opposed to the blinded studies, where either the participant is blinded or a researcher is blinded or both are blinded. So that question came earlier, double blinded study. So this is the opposite of those, where there is no information which is hidden, it is open. Whereas interventional studies, which are clinical trials, they will take the blinded approach when what intervention is being used to which one. The participant is also blinded, the researcher is also blinded, or one of them is blinded. Sometimes even there may be 4 or 3, 2 different groups, including, I think some of the trials have even 5 groups. So one group is open, that is, they know what intervention they are getting, whereas the other groups are blinded. So there are various types of these designs. I hope I didn't make it more confusing.
Well, it is very clear to most of us. The final two questions. One is from Professor Stephen Okeo. Sometimes I get disappointed by design chosen by students. Is it possible to advise and encourage higher level students, e.g. master's students, to particular study designs commensurate with their level of study? Dr. Ajay or Prof, anyone?
Yeah, I would say that may be one alternative to do that, but it's also important to introduce higher level students to all this methodology as early as possible, so that they can begin to learn more about them. I know that at the master's level itself, it's just to note or to train students to be able to practice some of this method, but I would agree that a randomized control trial would take time and lots of money. So maybe a master's student shouldn't be attempting the randomized control trial. Maybe they can do other designs other than randomized control trial. Maybe at the PhD level, they can do randomized control trial. So yeah, that's the suggestion is actually one template to follow, and I'll probably agree with the suggestion.
Yeah, thank you.
So if I got the question correct, what the professor is asking, I think what universities should be doing, provide some support when the students are designing their studies. That is, in Aga Khan, I can give example. We have made it mandatory that every resident who is developing his proposal should have a methodology supervisor. So everybody is not a methodology supervisor. Everybody is not very good in the methods. So there are some people, a small number of faculty, who are experts in the methodology. So we see that the student takes advice from the methodological supervisor, and also they have a consultation with a statistician in case they need complex statistics methods and analysis. So before they present their proposal, they get support from a methodology expert and also a statistics expert. So the universities, if they take care of that, then the quality of the proposals of our students will definitely improve. Thank you.
Thank you, Doc and Prof. Now, the very last question from Aricha Stephen. What is the main difference between case control and retrospective cohort studies?
Thank you. Case control, I think by design, is a prospective study. You have cases and you have controls, and it's a prospective study. Retrospective cohort is you have a cohort and you are collecting data which is past already in time. So there also there may be control. You collect data from controls without exposure or without disease or without getting affliction, and also healthy may be healthy, but you are collecting data in past, that is past data. And sometimes it has a lot of limitations. Data may not be captured, the records, medical records, case files, all those issues are there. Their quality tends to be pure. I mean poor, as opposed to case control studies which are prospective, where you have designed, you are capturing data on a data collection tool, everything is done prospectively. That is the basic difference. Thank you.
Thank you very much, our guest presenters, for the QA session, which was very well done. Now, over to you, Dr. Leach,
Prof,
for the closing.
Prof, there's one last question on ethics consideration.
Okay, go ahead. I can't see it on my screen. Okay. In ethical considerations, does one need to seek clearance from Ethics and Anti-Corruption Commission?
Very interesting. That is very interesting. Supposing the research, there may be some researches which are about corruption itself, then maybe they need to take clearance. It's not ethical clearance, but actually clearance. Like supposing somebody has taken ethical clearance for so many things, but still, supposing you want to publish some particular data into a journal, into an international journal, you may have to seek other permissions. Like institutions will say that infection control prevention data should actually go through the medical superintendent or the director or somebody, because there may be information which is negatively impacting on that particular organization or institution, and they have a right to prohibit that this information we don't like to be published. So unless there is such a research which is about corruption, and then they need to seek permission from Anti-Corruption Bureau, otherwise I don't think there is anything like that. If the research concerns corruption, maybe they have to take a clearance before they do the research. They collect data, depends on what exactly is going on in that particular research. Maybe Anthony, you want to add something?
Yeah, so usually for research, just like Prof had said, you may just want to apply for ethical approval. So yeah, in Kenya, you apply for the narcotic permit. You may, if you are doing your study in the county, you may want to go to take permission from the county. When you are going to the community, you may want to take permission from the community leaders. I mean, those are the steps you need to take. Other than that, I don't think you need to go to an anti-corruption body for any clearance.
Okay. Another question has been added, the very last one, but that is together with a raised hand from the one who asked about Anti-Corruption Commission. So let us go to the question first, and then Kipkoech Maureen can ask the question that she has. So Oluomachi is asking, can a cross-sectional study be a case control study also? That is to...
Cross-sectional case control, I think, are totally different. I can't see how a case control study, yes, because you don't capture all the cases and all controls, it will be cross-section of some cases. Then maybe you will say that it is a cross-sectional case control, but we will not say that. We will simply say it is a case control study. It could be cross-sectional, but it will still be called case control study. Thank you.
Okay. Kipkoech Maureen, you raised your hand. Could you go ahead and ask the question?
Thank you so much. I'll first start by appreciating the organizers and also the panelists for the well-informative webinar that we've had tonight. My question is not that complicated, and I would really like to get the feedback from the panelists. I'm doing a mixed study whereby I'm using both qualitative and quantitative methods or approach. And I'm made to understand that calculating the sample size for qualitative part, I'll have to use the prevalence that exists on the specific area of interest, which I've done. But then when it comes to qualitative study, I know there are some approach that maybe I'll use to get maybe the specific number of healthcare providers that I'll recruit them to participate in key format interview. Maybe one of the panelists can guide me through, because for FGDs at least, maybe I may do it to point of saturation. But then I cannot use the 200 participants and recruit like 200 healthcare providers to key informat interview. So I'm kindly requesting for a shed of light there.
You will have to divide them into groups.
Yes.
Instead of 200 individual participants, you will divide them into groups. Usually, that is what my experience, what I have seen, is the large number of participants, you will be dividing them into groups, and then you will be doing group discussions, and then out of each group something will come out, but it will not be 200 pieces of information, it will be just 6 or 7 or 8 pieces of information. That is one way of tackling this. And Anthony, you want to add something?
To add to what Prof has said, so because you already have a quantitative study, you just need that perhaps to complement it with a qualitative study. So in that case, you don't need to interview the entire 200. That's and I agree with you. What you need to do is to ensure that you have collected exhaustive information. You want you to have collected information that you will say, oh, okay, there is no more new information that is emerging. So there are two school of thought to doing that. You begin to interview people until you discover that there are no new information emerging. So meaning you interview people today, maybe 2 or 3 people, you try to read all the transcript and see the information that is emerging. You continue the following day. Maybe by the time you interview 20 people, you discover that there are no new information. So you say, oh, I've reached saturation. But you must take note that when you're interviewing people, the important thing in a qualitative study is the mix of the characteristics of the people you are interviewing. Now you're interviewing health workers. I mean, there are different categories of health workers. So are you interviewing nurses? Are you interviewing doctors? So you want to look at that mix. Are you interviewing male and female? So you want to interview male doctors, female doctors, because they may have different or slightly different perspective. Are you interviewing junior doctors and senior doctors? So that mix of your participants is very, very important in a qualitative study. So you wouldn't interview only 20 health workers that are only female when males can also respond. So you may want to actually think about the mix in terms of all the characteristics, both in terms of gender, in terms of work experience, in terms of different specializations. And maybe by the time you interview about 30 people, you should have reached saturation by then. You don't need to interview even up to 50.
Thank you.
Ladies and gentlemen, that brings us to the end of the QA session. Over to you, Dr. Leach. If Dr.
Okay.
Leach, okay.
Thank you so much, Professor Nditi, for moderating our Q&A session. So now our webinar is almost coming to a close, and I would like to invite Dr. Amos Otara, KMA Vice President, to give a vote of thanks to our speakers and all participants and close the webinar. But Dr. before we go ahead with this, I noticed there was a question by Stella Kibet that you answered live to her, which was addressed as for junior doctors with little resources not studying in any institution and who want to be independent research, what ways can they overcome the barriers of cost, permissions from ethical research bodies, letters from supervising researcher, etc. required as part of the NACOSTI requirements to obtain a data collection permit? And then her second question was, is there a mentorship body for junior doctors interested in research to get guidance from established researchers from data collection to publishing? So Dr. Amos, if you can lightly comment on this and shed some light before you give us a vote of thanks. Dr. Amos Otara, are you there? Dr. Otara? All right, can I hand over to Dr. Simon Kigondo, please? Dr. Kigondo, are you there?
Sorry, John, I can maybe just make a comment on behalf of NEC on that. The KMA has a research committee that we are the one hosting this meeting and also does a bit of mentorship. So if Stella has any concerns of that nature, the research committee would be more than happy to give some guidance on this. So they should feel free to get in touch with the KMA office. Yeah. Thanks.
Yeah, thank you very much, Chafasto. And yes, this, thank you very much, Lich, for that hosting. And indeed, as Kenya Medical Association, that is the reason, together with our East African Medical Journal, that we are bringing this series, so as to provide these opportunities to those who may not have the opportunity to actually do research, and they can become members of Kenya Medical Association, and we will assist them in doing this. We are looking in the long run to be a research unit and facilitate health workers to actually do research and publish in the East African Medical Journal. And with that, I want to thank all of us for participating in this webinar. I want to thank Dr. Leach for fantastic moderation. I want to thank Professor Revathi for the excellent presentations, and our Professor Onditi Elias for his good moderation. Ajay was excellent in his presentation, and we have the assistant editorial personnel, Mariam of East African Medical Journal, and Chafasto. We want also to thank you for that. And we also have Peter, who is our IT officer, and our CEO, Dr. Elizabeth Gitau, to thank her. And everyone who has participated in this webinar. We will be bringing more regularly. And we will also, you can also find the material in the YouTube page of Kenya Medical Association if you want to re-listen and relearn. And you can contact us directly at the association. And with that, I want to bring this webinar to a close. Thank you to all of you.
All right, thank you everyone. Our next webinar in the medical publishing series will be in April. Good evening and have a wonderful night.
Thank you very much.
Bye. Thank you.